All right, we're back, everybody. Movement is my medicine again. So today we're going to talk about the 90-90 hip stretch, or hip mobility drill. So we've had a lot of people come in lately with lower back pain in the office. This is one of the exercises that we like to give those patients with lower back pain because it really does make a difference. Our hip mobility drives what happens in our lower back. So we want to make sure that we have those hips moving really well. So I'm going to ask Nicole to come in today. She's going to demonstrate this drill for us so you can take a look at it. Please don't laugh at our matching green shirts. We didn't call each other this morning and get the memo. So we're going to set ourselves up in a 90-90 position. So basically what we mean is we want the hips to be at 90 degrees. We want her knee to be at 90 degrees. We want her ankle to be at 90 degrees. So everything should be a right angle. So what we're going to do here is we're going to work external rotation of the left hip, the front hip. The back hip, we're going to work internal rotation. So then what we'll do is we'll have the patient switch and face the other direction and do the same drill again. But to do the external rotation portion of this, what Nicole's going to do is she's going to kind of sit up nice and tall because we don't want her back to bend while she does this. We want the movement to occur at the hip. So while she's nice and tall, I'm going to have her kind of press forward, pushing her chest towards the wall in front rather than the floor. I want her to actively push her left knee, that front knee, down into the ground to really kind of create an isometric contraction, which creates even more of a stretch. In this position, I want Nicole to make sure she can breathe, right? If you can't hold that position because you're out of breath because it's so uncomfortable, back off. Don't stay in that position. The other thing I want to make sure that she can do while she's in that position, besides breathing, is I want to make sure that she holds it long enough that she actually gets a stretch out of it. Do you notice me stalling a little bit there? Yeah. So if you're holding it for 3 seconds, you're not going to get a stretch out of it. You can back out of it, Nicole, if you need to. But we want to hold it for, 10 to 20 seconds. It's a soft number. You determine how long you want to hold it for, but make sure you're getting about 10 seconds at a minimum out of it. Now, to do the internal rotation of this back hip, what I'm going to ask Nicole to do is I'm going to ask her to press down into the floor with her right knee, and I want her to kind of rotate her body towards her right ankle, and she should feel that that starts to cause a little more internal rotation of the hip, so she's getting a little bit more mobility in the hip. You feeling that there? So again, I want to make sure she can breathe while she's in that position. If she's too uncomfortable because of the stretch or because of the mobility drive, if she's getting too much discomfort, she's not going to be able to breathe. So I want to make sure she's breathing. I want to make sure, again, that she's holding for somewhere between 10 and 20 seconds. So this is the 90-90 hip mobility drill. In order for her to do this completely, I would have her turn and face the other direction and do the same thing again, but I'm not going to bore you with making you watch it again. So this is our 90-90 drill. If you have any questions, any other suggestions, exercises that you guys want to see, just let us know. Comment on this video on YouTube or feel free to send us an email or a Facebook message and let us know. Thank you very much and have a great day.